I think that whether it is a pharmacist or someone who works with the pharmacist that can begin to build the relationship and close that gap between the pharmacist and the patient is really important. But that's why people do develop a relationship with their pharmacist. They go back to the same people, same place all the time. So I think there's a great opportunity here. I think we have to capture that somehow and figure out also how community-based organizations like ours could support that kind of relationship building. You know, why does the pharmacist always have to be behind the counter? Why can't they come to the Y and begin to have a meet and greet and talk to people and ask questions? In March every year we celebrate Healthy Kids Day. There's no reason why we shouldn't have pharmacists available just to ask questions about kids' over-the-counter drugs. I know parents have a lot of questions about that, and pharmacists I think are just somebody that sometimes we don't think about when we're doing that kind of stuff. So I think they're a real asset, obviously.
Great.
I think when it comes to prevention, we need everybody in the game. And certainly pharmacists can play a very important role in the community. They see people at the retail pharmacy, they see them a variety of different places, and they can encourage them, in addition to the drugs they're taking, to live healthy lifestyles and do the other things that help maximize the value of those drugs. They can also help them in compliance, because we know compliance is a huge issue with many people, and taking their drugs, taking them correctly, taking them and refilling them when they should. And so all of those areas are places that pharmacists can play a role in helping people in both primary, secondary, and tertiary prevention.
Hi, I'm Tracey Moorhead. I'm the President and CEO of DMAA, the Care Continuum Alliance, and we support the notion of the healthcare team, believing that all clinical professionals have a role to play in supporting the physician and the patient in managing their care.
I'm Ken Thorpe. I'm the Executive Director of the Partnership to Fight Chronic Disease. And one of the key elements of healthcare reform is more effective management of patients that have multiple chronic healthcare conditions. And one of the big challenges that we face is getting people to actually fill their prescriptions and refill them on a timely basis. So the whole area of medication adherence, compliance, getting information to patients about dosing and how best to take their medications really is, I think, an underappreciated part of what we need to do to make people healthier, keep them out of hospitals, keep them out of repeat visits to the emergency room. And we've got to find more effective models and approaches to do that. And certainly we think pharmacists are a key element of that battle. So I would hope as we move along in this healthcare reform debate, we recognize one of the key challenges that we face is the more effective management of patients with chronic disease. And certainly a key piece of this is just simply getting people to take their medicines at the right time, at the right dose, and in the right places.